let's try that again. Okay, so here's my final dressing change. So again, my equipment's been gathered. It's over here on the side. You can't see it. Wash our hands, provide for privacy, and then introduce ourselves. So hi, my name is Michael. I'm gonna be your student nurse today. Could you please verify your name and your date of birth for me? Okay, perfect. So the purpose of this procedure is to change and assess your wound dressing. Obviously there are times where I'm gonna have to expose different parts of your body. Is that okay? Okay, perfect. Yeah, so now we would move into checking the provider order, making sure this is the right thing. Verbalize again the purpose of this procedure. So here we are getting ready to assess and change your wound dressing. I'm going to verbalize and talk you through it as I'm doing different things. Do you have any questions? No? Okay, perfect. So here we are, and this is when we would do the pain assessment. So on a scale of 0 to 10, 0 being no pain, 10 being the absolute worst pain you've ever experienced, what would you rate your pain? And then you would assist the patient into a comfortable position getting ready for the procedure. So here we are again. We're gonna wash our hands before doing anything. And then we are going to put on clean gloves. Making sure everything looks okay here. Alright. So here we go. This is the only size that fits me. We're gonna expose this part of the body here, and this is when we start to take off the tape. So I'm gonna use the pull-push method, pulling it towards the wound site and pushing the skin down so that way it is not directly affecting the patient. Okay, and then here we would assess the covering, the old covering, making sure that there is, if there's drainage, what is the color, what does it smell like, is there any odor, how much is coming out, things like that. So then we would dispose of this properly into the proper container. And then at this point, we would look at the wound. So is there, well, excuse me, I would use something other than my fingers to take out the wound hair on the inside. So then we would look at the wound. Is there any inflammation? Is there any more drainage? Does it stink? Is there, does it look like there's signs of infection? So is there more swelling? Is there more redness? Is there drainage changing, or is it like any worse? Like, is the color darker? Versus whether it's healing, is the wound decreasing in size? Things like that, making sure that everything looks good. Okay, and then at this point, these gloves are considered dirty, so we're gonna get rid of them. Again, properly disposing of them, and then again, we're gonna wash our hands. And we're going to put new gloves on here. So now we're gonna get ready to clean the wound here. So before we do that, we are going to, again, look at the size of the wound. So measure the depth using, you could use a swab, you could measure the inside of the wound, the width of the wound going, so if I'm facing this way, it'll be from side to side, it's the shorter side, and then the length, so how long is it? So looking at this here, using this tool, in centimeters, okay, so we're at 8 here, we're at 12 centimeters by 2.5 centimeters, so length is 12 centimeters, width is 2.5 centimeters, and then depth, probably wouldn't do this, you would use a swab in order to do this. To measure the depth, we're looking at 1.5 centimeters for depth as of right now. So now we're gonna get our gauze ready, and these are sterile. So I don't have the 4x4s on me right now, so we're gonna be working with what I have, but you would use a 4x4 sterile gauze in a tray to assess this wound here. Open these up. And again, you would just peel the gauze back, making sure that you have it. But since I don't, that was what you would do if you did have them. So again, you have your clean gloves on. This is all set up. You're going to use a little bit of saline solution here. Pouring it directly on the gauze, excuse me. A little bit there. A little bit there, making sure you're not touching the gauze directly. And at this point, you're going to grab the corners and use the middle of the gauze in order to clean the solution, going from top to bottom, clean to dirty, in one swipe, and then discard. And again, with this, go from one side to the next, one swipe, discard, and then need one more, excuse me. Again, you would be using the sterile tray. It's a lot easier, gauze are bigger, and you wouldn't have this issue. So full of these. Again, making do with what I have. Pour this on here a little bit. Grabbing the corners again, not the middle. Pinching them together to clean the wound, and then you would do the other side. Clean to dirty, top to bottom. One swipe, discard. So now that we have that, get rid of this. Again, our gloves are dirty, so we're going to take these off, discard them. Now, forgot to mention, before doing that, you would then assess and see if they are on any medications. You would then do your 3 checks before providing that medication. So before you go and see the patient, so you would do it first when you're looking at the medication order. You would do it again when you're drawing up the medication, and you would do the 3rd one at the bedside with the patient. Again, verifying their name and their date of birth, making sure this is the right person. And you would identify their 11 rights. So you would have your right drug, your right patient, right drug, right dose, right time, right route, right documentation. And then you would have your right reason, right response, right to refuse, right education, and what's the last one? Right to assess. There we go. So you would have those. So now we're going to go into putting the dressing onto the patient. So we're going to wash our hands here again, don our clean gloves. Oops, wrong hand. Turn this around. Okay, put this on. Good deal. Alright. So again, making sure this is clean here. We are then going to use the abdominal pad and some of the inside wound dressings to pack the wound. So we use these and pack the wound as necessary, so placing them on the inside after the wound has dried. Again, probably wouldn't use my fingers, but I'm making do with what I have. Making sure that this looks okay and that the wound is packed if necessary. So with those, we then will move on to the abdominal pad here, opening this up. Alright, so opening this up, again, making sure the patient is okay and is still comfortable. I'm going to place this on your wound here. Make sure it is sterile. It's solid, not sterile, excuse me, solid on the patient. And then we would use our tape here using the window pane method. So I'm going to start at the top. We're going to lay it down and rip this off here. Make sure this is placed appropriately. Then heading into, oops, gloves definitely messed this up. Come on, there we go. Heading into this side, making sure it's overlapping a little bit, making sure it'll stick to the patient and it's not coming up. and to make sure that the dressing is secure to the wound, so that way the wound isn't exposed. Then doing the bottom, make sure this sticks. All right, last but not least, one other side. Window pane method, making sure this looks good to go here. There we go. All right, so now that we have that here, we are then going to use one more piece of tape, just so it's easier to label. Since this dressing is cotton, we're gonna stick it here, label the time, which is 1450, the date, which is 10/21, 10/21 or 22, 24, pretty sure it's 22 actually, excuse me. And then your initials. Okay, and then you would get rid of your gloves here. Excuse me. Get rid of your gloves here. Again, dispose of them properly, wash your hands. And then you would assess them, making sure, like, hey, how are you feeling after all of that? Do you feel okay? How is your pain level? Making sure that everything is all right. And then you would cover them back up, make sure they're all set to go. And then, yeah, you would say thank you for your time. I appreciate you working with me. I know that's not necessarily the easiest thing to do, but we got it done and now it's all clean. It's all ready to go for you. And that is a wound dressing change.